Logan, West Virginia, a city located along the banks of the Wyandotte River and on the footsteps of the Appalachian Mountains. Most of the residents in Logan have lived here all of their lives. Their great-great-grandparents moved here decades ago for the coal industry. President John F. Kennedy even graced Logan during his political campaign and won the heart of coal country. Logan was first established in 1857. Most of the buildings in downtown Logan are old and shabby. There are new buildings, however, being built to replace the original structures. Most of the older buildings in the city are abandoned and oftentimes victims of arson. Neighborhoods in Logan have plenty of charm with an older-looking feel. Many new homes have been built with the latest trends, but still portray the southern charm that the city of Logan is known for. There was a mixture of old, young, and middle-aged individuals within the community. There are generally more older and younger compared to middle-aged because the middle-aged population have left the area in order to pursue jobs in other states that provide more diverse job opportunities. In downtown Logan, there were no homeless individuals observed, but an abundance in low-income and poverty-stricken families. The majority of the residents are white Caucasian. The population appears to be homogeneous with little to no subtypes. Logan, West Virginia has 844 males and 935 females. The median resident age is 40.3 years old. 90.2% of the residents are white, 5.1% are African American, 2% are Hispanic, 1.7% are biracial, and 0.7% are Asian. 6.4% of residents 25 years and older are unemployed. 45.4% of the population is married, while 9.9% are divorced. The infant mortality rate in Logan, West Virginia was 5.6. The crude death rate in Logan, West Virginia was 474 deaths. The leading causes of death were the following: diseases of the heart, malignant neoplasm, chronic lower respiratory disease, accidents, cerebrovascular disease, and diabetes. Leading diseases that affect the members of Logan, West Virginia are obesity, which affects 40.3% of the population. Diabetes, hypertension, high cholesterol, and heart conditions are other leading causes of disease. Drug-related deaths include 38 overdoses in Logan alone, which 10.4 rate of death. The rate of death in all West Virginia ranks only 5.3. There are indications of different ethnic groups, including different restaurants. There are 2 Chinese restaurants and 1 Mexican restaurant. There is also another Mexican restaurant coming to the area. There is an abundance of churches in the area of all denominations. The lawns are well manicured in most areas. However, the actual hillsides and riverbanks are covered with garbage and litter. Many of the homes have flowers and trees. Gardens can be seen in backyards as well as large lands. There are many historical markers in Logan, including the burial site of Devil Anse Hatfield, who was the leader of the Hatfield family during the famous Hatfield-McCoy feud. The birthplace of Princess Sarah Coma and Chief Logan are also marked at the Chief Logan State Park. The actual city of Logan also has its own historical marker. The community has well taken care of areas and other areas that are dilapidated and run down. The air quality is clear compared to cities of larger population and factories. The natural beauty of Logan is remarkable, with the Wyandotte River flowing around and throughout the city and the Appalachian Mountains above it. In some parts of the city you see beautiful houses with manicured lawns, and other parts of the city has houses that are falling down with trash and garbage surrounding the yard. There are many stray animals in the area that are picked up by the local pound and euthanized every Tuesday. Wild animals can be seen all over the area and include black bears, deer, turkeys, coyotes, and other wild animals. The Chief Logan State Park has a wildlife exhibit that includes 2 wild boars, 2 black bears, 3 bobcats, a red-tailed hawk, an owl, and various snakes. Deer can be seen in abundance in the park and the city. There are many deer crossing signs warning vehiclists about their occurrence. Fresh spring water can be found within the mountains and up hollows. The Wyandotte River flows through the area and is often muddy and polluted with raw sewer as well as litter. The city has a water treatment plant that treats the water and distributes to paying customers of the City of Logan Waterworks. Families living in the outskirts of the city and up hollows use well water. The City of Logan experiences all 4 seasons and has a cold climate during the winter months and a hot climate during the summer months. The City of Logan is 1.16 square miles and 1,532 people per square mile. The most prevalent diseases within Logan are the classic conditions of CHF, COPD, hypertension. Obesity can also be seen in abundance. There are no shelters in the community. There are no herbalists in the community. Logan has its own hospital. Logan Regional Medical Center is a 132-bed acute care hospital with a Level 4 trauma center and women's center. There are plenty of family health care providers in independent offices throughout the city. There's also specialists such as pediatricians and endocrinologists. There are some home health agencies in the area such as ARH Home Health. There are 2 major nursing homes, which are Trinity Healthcare and Genesis Healthcare. Mental health services include Logan Mingo Mental Health. The health department is centered in downtown Logan, which allows for ease of access to the residents. There are resources outside the community, which include many medical supply companies and more family health care clinics. The economic state of the community fluctuates, the reason being the community relies on coal as its major industry. When the need for coal declines, so does the demand for coal miners. The city of Logan has seen many recent layoffs due to the shift to cleaner energy and strict environmental laws. Whenever coal miners get laid off, this affects every business, including the hospitals, clinics, grocery stores, hair salons, and clothing stores. Without health insurance supplied by the coal companies, the former employees do not seek adequate health care, leading to more health problems. Everyone in the community suffers when the coal market goes down. People mostly shop at the Fountain Place Mall that has a Walmart, Dollar Tree, Burke's Outlet, Shoe Show, and Lowe's. There are also smaller businesses and many different restaurants at the Fountain Place Mall. There are also individual-owned businesses within city limits. Food stamps are prevalent in the area due to the poverty and low-income families. There are signs at many of the stores indicating the use of EBT or WIC. Most of the private restaurants do not accept EBT cards. The unemployment rate in Logan is 64%. The median income in Logan is $25,163. The general socioeconomic status of the population is low to poor. Most people in the area own their own vehicle. There is a bus that has different destinations and is owned by the Tri-State Transit Authority. There used to be a taxi service, but has closed down in recent years. When assessing the community, you see vehicles, bicycles, motorcycles, and ATVs as means of transportation. There are sidewalks in downtown Logan that make it easy for people to get around. There are also sidewalks in the residential community. The City of Logan has its own city police department and fire station. The Drug Task Force of Logan also helps as a protective service. Waste Management is the garbage disposal company and has many waste disposal receptacles in the area, including dumpsters and trash cans. There are also recycling places in Logan that are privately owned. The Air Quality Index showed an AQI level in 2010 was 36.7. This is about average. There are neighborhood crime watches, and the League organization uses Crime Watch as well. The residents report feeling safe, but in places where drug trafficking is common, safety is a concern. There are plenty of political signs on the billboards, as well as the side of the road for elections. The city councils hold meetings weekly, but are not advertised. The Democratic Party predominates the area. The common area where people gather is Chief Logan State Park. The Logan Banner is the local newspaper. People usually have television and radio in their home and listen to 101.9 FM, which is Logan's own WVOW. The formal means of communication include cellular phone, landlines, email, and the U.S. Postal Service. It is also common to have people communicate via CB radios. There are many schools in the area, public and private. The 3 public schools that serve Logan are Logan Elementary, Logan Middle, and Logan High School. The Christian school in the area is Beth Haven Christian Academy. There is one library that is located and attached to the Logan Middle School but serves the public. Logan County Schools is ran by Superintendent Wilma Ziegman, with Phyllis Doty taking over the title. The schools have a good reputation compared to other schools in the county. Logan High School is a AAA school and is known for their athletics. Logan has been nicknamed the City of Champions. There are many extracurricular activities including football, basketball, softball, tennis, track, cheerleading, soccer, and archery. There are school health services located within Logan High School, which is a clinic that is ran by a PA and nurse. There is a school nurse in each school, and the main school nurse of Logan County Schools is Christy Skaggs. Children play in the park, the school grounds, and the park pools for recreation. Other forms of recreation include the bowling alley, convention center, and cinema. Children often play outdoors and with other sports leagues. Facilities for recreation include the new Chief Logan Convention Center that has basketball courts, tennis courts, and a swimming pool. We feel that most people in the area are proud of their community, while others look down on it. Logan was once a booming city in the 1920s and 1940s, but because of the decreasing economy, most of the opportunities have diminished from the town. Strengths of the community include the small size and friendly atmosphere. Problems in the area are the drug use. Drugs are an increasing problem in the area. Drug abuse causes theft, death, and broken families. Many children in the area are produced from drug-stricken families and often are reported to Child Protective Services. We think that health in the community is not optimal because of the lack of knowledge. Many of the community residents are older and do not know the preventative measures that are needed. The lifestyle and diet of the older population has contributed to type 2 diabetes, congestive heart failure, hypertension, COPD, and other concerns. I think that primary prevention should be looked at in depth with the younger population to prevent the disease process in later years. Potential problems that can be identified is the condition of the lungs of the underground coal miners. Many of the older men in the area suffer from black lung, and unfortunately it will not get any better because it's the only means of living in southern West Virginia. Obesity is also a rising concern in the area. There are plenty of fast food choices in Logan, but no healthy food choices, besides one Subway. Many people in the area prepare their food with plenty of fattening ingredients and carbohydrates, leading to all of the significant diseases found within Logan County. The primary nursing diagnosis for our community was ineffective community therapeutic regimen related to drug and alcohol abuse, as evidenced by 38 drug overdoses and a rate of death of 10.5 in comparison to West Virginia's rate of death being 5.3 for drug overdoses. There was a 600% rise in prescription drug use since 2001, and visible signs of drug use in community members, such as track marks on their arms, and an increase in arrests involving controlled substances. The overall goal with substance abuse would be reduced in Logan, West Virginia, by implementing education and preventative measures at younger ages. The second priority nursing diagnosis for Logan, West Virginia is a risk for ineffective health maintenance related to lack of information on health maintenance resources. Many of the community members do not know where to go to find help for their diseases or information on how to prevent the disease process. Teaching plan include the knowledge deficit in the cognitive domain related to smoking cessation in community members who want to quit tobacco, as evidenced by 32.9% of Logan's West Virginia's population addicted to smoking tobacco, lack of knowledge and information on how to quit tobacco, and lack of support on actually quitting. The client overall goal was the percentage of Logan West Virginia's population that uses tobacco will reduce. The education handout focused on tips to help patients decide when to quit and how to deal with withdrawal and to reward themselves whenever they do quit. The Healthy People 2020 goals were aimed at obesity and drug use. Objective SA-19, reduce the past year non-medical use of prescription drugs, really would benefit the community of Logan, so you could reduce the drug use. It affects every family. Nobody is safe or exempt from the harmful effects that drugs has on a person, their family, and overall well-being. The second Healthy People 2020 objective that would benefit the city of Logan would be reduce the number of adults that are obese. In Logan alone, the leading health concern is obesity. 40.3% of the population suffer from obesity. Reducing the number of obese community members through community activities would also reduce the other prevalent health concerns in the area. This objective is NWS 09, which is reduce the number of adults who are obese. The first research article discusses reducing obesity in the community, especially childhood obesity. It is entitled Educating Healthcare Professionals in Advocacy for Childhood Obesity Prevention in Their Communities, Integrating Public Health and Primary Care in the Be Our Voice Project. This research suggested getting primary health care providers out in the community to teach and advocate on ways to reduce obesity, especially in our children. The second research article was actually a drug prevention intervention that used the internet to appeal to adolescents. It was entitled Developing the Climate Schools, Alcohol and Cannabis Model. a harm minimization universal drug prevention program facilitated by the Internet. This program puts children in scenarios in which drugs would be offered to them and teaches them strategies to avoid, as well as showing consequences if they would take the drugs or alcohol. Logan, West Virginia is a sweet town and is very dear to the people that live here. I hope to see an increase in health and wellness.